I welcome you all to today's session arranged by Bangladesh International Cancer Congress. I am Dr. Muhammad Saif Khalid, currently working as the Registrar of Department of Surgical Oncology, National Institute of Cancer Research and Hospital. Today, we will discuss about the clinico-pathological attributes of gastric cancer based on molecular classification. But before going into the discussion, we need to focus on some background issues. We all know that the gastric cancer is one of the leading cause of deaths worldwide, and still today it is very much have got poorer prognosis. And adenocarcinoma is the most part of them. In spite of having all the modern treatment facilities, the outcome is very much poor. And the main reasons are, underlying reasons are the variation in tumor aggressiveness and the molecular heterogeneity of the gastric cancer. That's why we need to focus on the underlying pathogenesis of gastric cancer to identify the biologically and clinically homogeneous subgroups and to improve the patient outcomes. Two notable research groups across the world subclassified gastric cancer previously based on some molecular subtypes. We all know about them. One is the cancer genome atlas, and another group is the Asian Cancer Research Group. But there is a big issues, big difficulties arising from these subclassifications, which is these two classifications have not yet reached full clinical utility, and the cost, immaturity, and complexity associated with these testings are also significant obstacles to their practical application. For this reason, there was always a need for new classifications of gastric cancer based on molecular subtypes, which can be more practically applicable. But for this reason, we need to think something outside the box. Firstly, in 2016, a research group based on Massachusetts, Boston, proposed this classification based on a protein and mRNA-based expression-based classification of gastric cancer. They proposed gastric carcinoma into 5 subtypes: Epstein-Barr virus positive, MSI positive, E. cadherin aberrant, P53 aberrant, and P53 normal. Most importantly, all of these classifications, all of these subtypes can be done, detected by simple and commonly available laboratory techniques like immunohistochemistry. They are relevant to distinct clinico-pathological features and in trends in clinical outcomes. And this classification was later validated by 2 USA-based research groups with larger sample size. There are some advantages of these classifications. One is MSI and Epstein-Barr virus positive groups can be responsive to immunotherapy and anti-PD-1 therapies. And there is strikingly absence of benefit of perioperative chemotherapy in MSI subtypes, according to their claim. So further, there was a large landmark study was done in Brazil. They found that their title was Gastric Cancer Molecular Classification and Adjuvant Therapy. Is there a different benefit according to subtype? They found that only P53 aberrant or mutant group gastric cancer treated with both chemotherapy and surgery had better disease-free survival in comparison with the surgery alone group. And in terms of other groups, there was no significant difference in disease-free survival between the Epstein-Barr virus, MSI groups, E. cadherin, and P53 normal gastric cancer. So on this background, we took a little endeavors, but it was not as little as we think. It was something like climbing this rocky mountain in our institute, in National Institute of Cancer Research and Hospitals. We conducted a cross-sectional study from January 2021 to December 2021 on gastric adenocarcinoma. This number of sample size was 48. These were the biopsy-proven adenocarcinoma operated, and sample was sent to the histopathology labs for further histopathological examination and immunohistochemical examination. The results shown here that the most patients come from the 51 to 60 years age of group, and most interestingly, this is the most striking parts of our study, which showed that 38% of our tumor was consisted of P53 aberrant group, and the other groups consisted about Epstein-Barr virus 4%, MSI 8%, E. cadherin 21%. This is striking. This is high number of patients. There is high number of E. cadherin patients in our subgroups in comparison with other Western groups. And P53 aberrant was 38% and P53 normal was 29%. Here also we can see that E-cadherin groups present early in age in terms of presentation. Below 45 years, there are 50% E-cadherin positive tumors. There are some clinical presentations, clinical features of our study. They are dyspepsia, anorexia, pain, hematemesis, melena, gastric outlet obstruction, and dysphagia. And all of these subtypes were identified according to the new classification. Among them, dyspepsia was significant, and it showed that 90% of E-cadherin tumor presented with dyspepsia, which is statistically significant. There are few histopathological features. They are site of the tumor, tumor configuration, histopathological types, and differentiation. Among them, we can see that tumor configuration indicates that 80% of E-cadherin tumors are from the infiltrative type. And regarding stage, T stage and LVI, the E-cadherin presents, E-cadherin and P53 aberrant tumor presents later stage in T3 and T4 stage, but MSI tumor presents in early stage. Most of them are T1 and T2. This is important and is statistically significant. Similarly, no MSI tumor, out of the 4, no MSI tumor presented lymphovascular invasion. So we observed that the clinical characteristics and pathological characteristics of gastric adenocarcinoma, based on our observation, we found that they correlates with the other landmark study done in other parts of the world. And the significant difference was in E-cadherin and MSI. We had large number of E-cadherin tumor. That is why we can assume that there have poorer prognosis in our countries in terms of gastric carcinoma. MSI gastric carcinoma was in our series in 8%. The factors which we consider significant in our studies, we found that dyspepsia, tumor configuration, and pathological staging and lymphovascular staging invasion was significant. And this comes to a crossroad to us in front in terms of treating gastric carcinoma. So there are different clinical and histopathological features, and they may vary according to molecular subtypes. Obvious need for individualized treatment protocol. This is the most striking features. We could not conduct any randomized trial. We just observed the clinical and histopathological features, but it should be done, or we can plan to carry out in further large-scale studies. Chemotherapy showed different impact on survival of gastric carcinoma according to the molecular novel subtypes, and no survival benefit was observed for Epstein-Barr virus and MSI groups who received chemotherapy. Gastric carcinoma with P53 tumor had a significant benefit in survival. So immunohistochemistry was the cornerstone of this research, and we can undertake larger study to see the effect of perioperative chemotherapy in gastric carcinoma patients to reach better survival. And finally, I should say that if we can think out of the box, something new paradigm or new treatment strategy may wait for ahead of us in terms of treating gastric carcinoma and improve the survival. So we can say that if I change nothing, if you change nothing, nothing will change. Thank you for giving me a chance to stand and speak before you. Thank you all.